Well, my research interests are related to people who use wheelchairs for mobility. And so they may be people who push themselves around in their wheelchair, or they may be people who are pushed by others or caregivers. And my interest is in looking at ways of enabling people to do that with the minimum amount of effort and as safely as possible. Well, one of the difficulties we found is that the design of wheelchairs is, on the whole, designed for the person sitting in the wheelchair rather than the person pushing the wheelchair. When you have an obese patient in a wheelchair, the challenge of pushing people on slopes, especially side slopes, is quite a considerable challenge and can result in instability of the chair, the risk of it turning over, or big problems in making it steerable. So we're looking at the design of wheelchairs that would enable people to be pushed around safely, more effectively, when they're in those more challenging outdoor situations in the wheelchair. A very frequently used method in design is to start off by trying to model the situation. And so what we're trying to do is to develop a model of the biomechanics of the person pushing the chair, the wheelchair itself, and the occupant within the chair, and looking at those factors that influence safety and efficiency in moving the chair. And so the first step is modeling, and the second step will then be to make that model become a sort of dynamic method of measurement. And we use that type of technique for people when they're walking in what we call a gait analysis laboratory. And what we want to do is to create a laboratory like that that enables us to study people being pushed in wheelchairs safely and effectively. I think there are two aspects. One of them, of course, is direct treatment, which is to help people to reduce their weight, and that's obviously a key first step. The second one is we do also need to accept that that's a very difficult thing to do, and in the meantime we need to come up with some good strategies to enable people who are obese or bariatric to be able to live a better quality of life than they do at the moment. And so some of the things that we can do are to improve the facilities that we have for providing clinical treatments for people who are obese, making sure that there are fewer barriers for them to receive what many of us take as everyday resources for our care, and to look at some of the special equipment that might be needed in order for the professionals who look after people who are very heavy to do so safely and effectively.